Do you have lower back pain now that pain is in your legs? Well, our next guest is going to tell us how to treat that. Dr. Jonathan Duncan, he's with the San Antonio Orthopedic Group, and he is with us this morning. How are you doing, doctor?
Morning, sir. How are you?
I'm doing great. Good morning. So you've got the lower back pain, and now it's in the leg. Is that called sciatica?
It is. It's commonly referred to as sciatica. Often the medical term is radiculopathy, but most people call it sciatica. And so there's a lot of different causes of leg pain. It's key to differentiate if it's really coming from the back or if there's other causes. As you know, people can have hip pain, knee pain, foot and ankle pain. A lot of that can mask as pain coming from the back.
So there's a lot of symptoms, I guess, and if you have pain in your leg, maybe it's coming from your back and you just don't know that.
Very well could be, very well could be.
Wow.
One of the common ways that it shows with patients is it's a burning, a tingling, a numbness, sometimes even a weakness.
If you let it go, you can get to the point where it's going to be hard to walk eventually, I'd imagine.
It can be, and oftentimes that's when people show up in my office when they're having trouble walking, unfortunately.
Yeah. How can folks be diagnosed? How do you diagnose somebody with sciatica?
So I like to say a good old-fashioned history and physical, just a visit with your doctor.
Okay.
So a lot of people think you need an expensive MRI or some other, fancy treatment. Really, a good discussion with your doctor and a good physical exam can really tease out what's going on.
Okay, and so this is an example, right, of somebody's spine. Here's the base of the skull.
You got
it. Of course, hip bones, I guess.
So neck up here, lower back here. This is your pelvis. I had to guard this from your dogs. Your dog guests earlier.
Oh,
they were wanting to eat my model.
Right.
Told them the plastic model probably wouldn't taste too good,
Yeah.
but. So you've got your spinal nerves coming out at each level there, and eventually they form together to form the sciatic nerve, and that's where the term sciatica comes from.
Okay, so that nerve runs through the...
Well, the sciatic nerve is actually a little lower down towards the pelvis, but as these spinal nerves connect together, they can get they form the sciatic nerve, but they can get pinched up here in the low back by either a disc herniation or some bone spurs. There's lots of different causes there.
Wow. So if you come up with this problem, how's it treated?
There's lots of different treatments, and the key is the diagnosis, right? So if it's a disc herniation, we treat the disc herniation. If it's a bone spur, we treat the bone spur. So it's really key to get an exact diagnosis before the treatment.
Well, one thing's for sure, you don't want to live with this.
Absolutely not.
Yeah.
And there are lots of ways that can be treated. People think they don't want to go to the doctor because they think they're going to get surgery. There's lots of other treatments for sciatic pain besides surgery that are very effective.
Okay.
So important to look for those.
All right. If you think that you have got this problem, if you think you've got sciatica, what you want to do is you definitely want to call the San Antonio Orthopedic Group. Give them a call today, 804-5400, or you can go to TSAOG.com and get the help. You don't have to live with pain in your legs and back pain. Doctor, thank you so much for being with us today.
Thank you. Appreciate it.
All right. Stay with us. We'll be right back.